Center for African American Health. My name is Deidre Johnson, and I am the CEO and Executive Director for the center. For those of you who don't know us, the Center for African American Health is located in Northeast Denver. We're a family resource center. We've actually been around for more than 20 years. I'm committed to improving health and well-being of the African American community. We primarily and historically have done that through offering community-based, evidence-based disease prevention and disease management programs. I'm really proud of my team because since this whole COVID adventure started, we've really been able to be responsive, and want to celebrate them in the fact that during the month of May, we were able to help 345 people get access to food, pay their rent, and just take care of emergencies. But today, I want to encourage people to look in the, enter any questions you may have in the chat box. We'll also be posting mental health resources in that same location to share with community. Today, we're going to address the topic of systemic racism and COVID-19. And we actually have this topic planned for a few weeks. But not surprisingly, the world has erupted up to bring even more spotlight on systemic racism. But I'm really excited about our guest today. Kim Desmond is the director of the Mayor's Office of Social Equity and Innovation at the City and County of Denver. Kim is helping to lead the charge around the city's race and social justice initiative, which we'll hear more about today, and the work being done to engage community in making more inclusive decisions. And Kim, before we get started, I just want to thank you, the group that you invited me to join. I just want to let you know we had a meeting on Tuesday when we did the information around testing sites. We connected with those folks, and the center will have our first testing event on June 5th. So getting it done. Please tell us about your role and the work being done in the Office of Equity and Innovation.
Well, first and foremost, shout out to the Center for African American Health and for all that you're doing to proactively provide all types of resources to the African American community. As a person who's born and raised in Denver, most certainly am well acquainted with the work you're doing, and Deidre, your leadership has been spot on, so really appreciate that. And I'm glad to join this call because it's most certainly prevalent given just this month, I can say. I mean, historically, there's a need for anti-racist work. And so I get to actually do a job every day, which depending on the side of the coin, it's either racial battle fatigue and stress and are the best job of my life because I literally am charged with working in an office where we are literally dismantling inequitable policies, practices, critiquing budget decisions, and ensuring that we are doing that through an anti-racist lens. And so it is an office that's focused on just that, looking at the historic context for the ways in which systemic racism has formulated our policies and has formulated the way that people interact with our stakeholders, more poignantly African-American folks, Latinx folks, First Nation folks. And so our charge is to, not to forget our Asian folks as well, our charge is to look at our work through an anti-racist racial equity lens. And so these are the things that we do on a day-to-day basis, which makes it a mountain to climb.
So as a woman of color working within local government and serving in this really unique position, what has your experience been in addressing these social justice issues? Because I know it's not a walk in the park. How's it going?
That is a very loaded question. And I'll start out by just saying this, is that doing this work as a woman of color, you definitely feel the heaviness every day. Because sometimes you're charged with, when I enter into spaces, it's more of, oh, the equity lady's here, she happens also to be African-American with all my other intersects of my identity, and perhaps she's here to solve racism. And so with that burden, typically if that's hurled at me, I say things like, clearly, we're not expecting an African-American woman to solve the very thing that is brutalizing my body, right? Is that what we really do? I really have the power systemically to do that? And so in that, I would say as an African-American woman in this work, I am addressing and working towards the things that are impacting my livelihood, my family's livelihood, the trajectory of generations going forward and going back. And so that is, I'm literally in conversations that are impacting me personally. And so the level of racial battle fatigue and stress that goes with just that experience with being a leader in this space, but also being impacted by the decisions, it's a heavy burden to carry at times and can be stressful as well.
So what would success, because this is a new office, like when you think about year one, what might success look like for you guys?
You know, as we were formulating the office, I think first and foremost, I have to, in all honesty and actuality, shout out our mayor, Mayor Michael B. Hancock. I literally remember the conversation where he's like, share your best idea. And I'm like, well, I'm gonna get fired today. So simply because the idea was around us doing anti-racist work in government and labeling it that, like labeling it a racial equity focused office in the endeavor and being intentional with calling out systemic racism in local government. And so with our mayor's leadership, he agreed and asked me, like, what do y'all need? What do you need? And I'm like, you know, we need positions. And that came with not only folks who are training all city employees around hacking, identifying historic racism, but also like creating a series of tools to literally critique, dismantle, to redesign and re-envision these same things. And so we have an equity officer. I got to shout out Aaron Brown, who was in our office, and Michelle and Jessica and Jose. These are all folks who are in our office. And so when you ask us what success looks like, I'll be honest and say that I've been with the city going on between 7 or 8 years. This year's a blur with this pandemic, so I don't know what day it is. But the vision of success, when I first started this position, this office was not around. It wasn't until the mayor made the decision to make the office a thing. We were not talking about on an everyday open basis systemic racism. And now with city employees, because we are the training hub that provides all of the training around unpacking the historic context for historic racism, identifying interpersonal racism, dissecting institutional racism, it is a conversation with all of our city agencies. So I think one area of success is that we are openly talking about racism. People may think that's a small level of success, but when you're not talking about it, how do you identify it? So you have to first normalize conversations around racism before you can go and operationalize and do other things in that space. So for us, I would say the success has been normalizing conversation and labeling things, systemic racism. The next step, vision of success, is then saying, what do you do about it? I know there's a lot of organizations, consultants, folks who do racial equity training and work. Training on its own does not prevent or rid us of systemic racism, nor does education. You can't train your way out of racism. You can't educate your way out of racism, or why would we be here on the cusp of what has occurred with George Floyd in the protests with that. And George Floyd is not the first, and there are many other names that we can speak here. So training does not alleviate systemic racism. And so that's one part, that's awareness. So that's one vision of success. The other part is getting in there, rolling up your sleeves, and literally identifying what policies and practices that were intentionally built to create inequity. So you have to identify them, then you have to re-envision what those things should look like. And that's where the work comes at. So I would say in phase 2 of our work, the level of success and vision of success is to start to really get in to have a clear infrastructure of how do we identify policies that are racist in intent and structure, to dismantle, to redesign and envision the things that are more equitable for African-American folks.
That is beyond refreshing to hear. And I don't want to date myself, but I've been in the nonprofit sector for 20 plus years. And it's interesting because one of my passions has always been systems building, systems change. And what so many people who throw those words around don't realize is if you're just rebuilding a system with the same inequities, nothing ever is going to change. So that's exciting to hear. Plus I think there is a movement of folks who, they talk about health equity and other types of equity, and it's almost as if understanding that racism exists is the finish line, when that's just the beginning. It's not the full assignment. So thank you for that work.
Yeah, and I think that's important, because I realize that, to your point, Deidre, like, there are such buzzwords. You have folks who are like, yeah, we're doing equity work, but we're not talking about race. We're doing health equity work, we're not talking about race. Like, if you're doing true equity work, equity is not a buzzword. Equity is an outcome. And when you really define racial equity at its core, you're really looking at where there is no disparities. Like, it's when you can say, when you look at like the coronavirus, it's when you can say there is no disparities between people of color and our white people with who is getting the disease and dying from the disease, right? You look at other health things that we see in terms of like high blood pressure, hypertension, the infant mortality rates for African-American women, the mortality rates for African-American women. So true equity work is when you don't see those outcomes. And so those are things that, if folks are saying that they're doing equity work and they're not pairing it with systemic anti-racist work to reach that outcome, then in my opinion, and I can also say this is opinion of other folks in this field, is that it's not equity work. Equity work really means that you're taking a targeted approach to change the trajectory of disparity in outcomes, and you can point to it. That includes, like I mentioned, some for health. You can do the same thing for incarceration, for our Black folks who are overrepresented in our jails. You can do the same thing for education. Our kids of color who have a large achievement gap. And I'm not talking about the graduation rate. That's important. Don't get me wrong. We want kids to graduate, but I want to make sure that kids are able to do math and read and have those opportunity gaps closed or not existent. And so real equity work means that there is no disparity and you're able to measure the outcome. And if there's not a measure in your equity work, then sometimes I question that. And I say, if you're saying you're doing health equity work and you're not talking about race, then I ask the question, well, then what disparity are you addressing?
Exactly.
Like, what are you looking towards? Because it's a disparity outcomes-based conversation when you're doing racial equity work. And so our office, when we say we leave with a racial equity lens, we make sure that it's a racialized context to say these things were created intentionally as a result of systemic racism. And if we don't call that out, then how do we solve for it?
I'm looking forward to the day where we won't look at third grade reading scores and plan prisons, but we'll plan how to make sure those gaps go away. When that happens, that'll be a day.
Mm-hmm. When that happens, and then when it happens, when we don't see, I think we have to just call it out and where we're at right now. Like, this week is heavy. If you are a person of color and you're seeing these images, it's heavy because you're thinking about your brother, your brother, your uncle, your relatives, your kids, your sons. And so we have to call it out when something like that happens to George Floyd. We are not in this post-racial, harmonious, equitable place. When you're seeing, and that occurs to Black folks, when whiteness is weaponized in a response to racial bias and white people being afraid of Black people, we are not in a post-racial society when whiteness is weaponized to brutalize our bodies. And so these are all things that, to get to equity, we got to really be clear about how whiteness is weaponized and how, when it's weaponized, our lives are literally shortened. And that is a real thing. And so equity work, let's talk about how whiteness is weaponized, and let's talk about how it's paired with systemic racism.
So along some of the inequities we know that are caused by, amplified by COVID-19, I'm going to name a couple of categories. It'll be interesting to see your thoughts or what the city's been thinking of. Mortgage and rent assistance. We've heard some things about moratoriums out there. I know a couple of people we've helped were recently evicted. So there's what we hope to happen and what's actually happened. What are your thoughts?
I think first and foremost, when it comes to rental assistance, It's even understanding how the city, we have enhanced our support to include mortgage assistance. Now that's a key decision, because when you look at home ownership for African American folks, there's been intentional policies historically that has prevented home ownership opportunities with clear policies that now has accumulated the wealth gap that we see. And so I think when you offer something like rental assistance, we had to make sure we're now doing mortgage assistance, because we also don't want folks to lose their economic capital. That's the largest source of capital, is in your home. And so when you look at what we're offering around rental assistance, the decision for us to do mortgage assistance, that's in that cusp of saying that that's historic inequity, in that you want to make sure that folks who are African American can keep their home if they have fell on hard economic times during this pandemic. And so I think we got to get the word out more. And I think we got to get the word out around, if you need the assistance, there are city resources that can help you with rental and mortgage assistance. And we're making those processes less cumbersome. So we're working on that, because we know things can sometimes be bureaucratic in the number, application, all these things. And so our team has now got involved in looking at ways that we can be more targeted in our response to providing opportunities such as those two to our African American. And I say that because we're on a call with African American Center for Health, for African American, our Latinx, and our Asian folks who need the support. We're there.
Is there a central number folks should call if they're watching and want to know more about that?
Yes, actually, I'll pop it in the chat box. Okay. You can actually call 311, call 311, and there's actually a prompt. I might even know the prompt. I may or may have not been trying to test the way that feels. But yes, you can, I'll plop it in the chat, like the link to our temporary rental assistance program. It's not only offered by our housing, our new housing stability office, but also Denver Human Services. They also offer some of the same resources. So we have two city agencies who are focused on housing and security in those ways.
And what about when it comes to making folks who have the comorbidities we talked about earlier, so health-wise they're at risk, but they may also work for hourly wages, don't have an ability to isolate? Is there anything you're all able to think about or support them with when it comes to what they need to have?
Yeah, I think it's appropriate, Deidre, to talk about the group that you're in. And so our office has, and we've created a racial equity council, and we get things done. And so the Racial Equity Council is comprised of, and Deidre will tell you, there are leaders around the city of all racial, ethnic backgrounds, different types of not only activists, but also different professional types. And so we're charged with making sure that when we're responding to this pandemic, to COVID-19, coronavirus, that we are very clear about the impacts to communities of color. In that, we're saying, what does health access look like? And so in that, we got to make sure we're conscientious of, like, the disease gets a little bit more complicated when you have all these compounding health conditions, right? And so if you have diabetes, if you have high blood pressure, if you have other pre-existing health conditions that are higher disproportionately for people of color, then when you overlap another virus that's attacking your lungs and other organs, that can become exacerbated. Then you see the higher percentage of, or numbers of death for folks of color. So I think these are things that you have to have a targeted response to, how our health providers are not only saying, hey, you're diagnosed with, or you're not diagnosed, you have the virus, but also what's happening with the other areas of your health, what's happening with your heart. How are you maintaining the things resulting with diabetes? So these are all things that you can't treat health in a vacuum, because people of color, our health is not in a vacuum. We have all these other factors that are literally comorbidity factors, or makes things a little bit more complicated for us. So our Racial Equity Council is charged with making sure we consult with the public health arena. So we literally, Deidre will tell you, like, we literally work with our Department of Public Health. We work with our public health team to say, you're off the mark with this. Do this more when we're working with people of color. Do this less, do this more. And so when you talk about comorbidity in those factors in the context of systemic racism and how those things started, you got to be more poignant in your strategy to address it.
And thank you for pulling that together, because the other thing it helped do, and it's a great group of just doers, but we were able to quickly form partnerships. So along with our testing, it's not just us, but we're going to do it in partnership with the Foundation for Sustainable Urban Communities. And the goal will just be to have a rotation so that all Northeast Denver, someplace once a week, there'll be some access. So yeah, some early success fruit for you.
That was an early, and Deidre, I tell you, we, on that group, we were very getting things done. The moment that I said, hey, we want to make sure we have targeting tested sites for our demographics, Deidre was like, and before the call ended, it was set up, it was done. And so we're talking about testing, but I think the other piece that we're talking about is, what does that mean for communities of color? What does it mean, and why should we get tested? What does it mean that if you get tested and then you do have the virus and you have to, or you're told to isolate or quarantine, what happens when you need food? What happens when you need rental or mortgage assistance? We know that a large percentage of our low-wage workers also intersect with being communities of color. And so, like, what happens when you don't have the time off or the luxury to say, you know what, I'm gonna work from home virtually, or I have the disease and I don't have the days. And so with this Racial Equity Council, we're informing, like, what happens after you have the virus, and we want to make sure with our office that you're taken care of. And our mayor is supportive of that. Like, he's definitely want to make sure that we are laser focused, which is why he created this office, that we're laser focused on supporting people of color. And these are things sometimes you don't hear a lot, but he definitely is passionate about and dedicated towards making sure that we're not leaving behind our communities of color, which is why this group was formulated, to make sure we're informing him directly.
Can you talk a little bit about masks, kind of mitigating concerns?
We have, you know, to be Black in America, anything with a mask kind of makes you nervous. Yeah. So it was a decision, I can say. We wanted to make sure, back to the vein of that, our low-wage workers are protected, right? And so you wear a mask, it protects me. I wear a mask, it protects you, right? And so the decision to wear masks is just for that. But we know that there are racial biases that we're not going to solve. And so when you make a policy decision that requires any type of face mask, bandana, you know, I'm a manual T-boat, so I might have a manual thing on my face, but like, you got to know that, like, that's going to come with, there's some perceptions and racial biases are still in that context. And so our office, we actually are in the process of working with our Racial Equity Council, is that we're going to start really bolstering up and talking about racism more. Like, what happens when people inherently have social fear with Black folks, and then they see this mask, and then there's these things around, can I confront you versus not? And so I think it's important to know that the decision to require the mask was all about safety for you, me, if we're in the quarters, and also for our low-wage workers who they're in the stores, right?
Right.
But also we got to make sure that we are not ignoring that racial bias didn't go away, and it's activating, and the fear that you have when you put on a mask. I know when I put on my mask for the first time, or my brother, I was talking to him, so I convinced him to wear a mask, and just that, I had to talk to him through, like, that fear. As a Black man wearing a mask, he's like, you're not setting me up, right? And I'm like, no, but I want to be conscientious of, never forget that we live in a country where racism is very real. It's not a perceived threat. Never forget that. We also are in a pandemic. And so I think in our communities, those two things are happening at the same time. We're in a pandemic where our lives are being impacted at higher rates. And then we also are still weathering systemic racism. You can't forget those two things. So when you're wearing your mask, don't forget you're Black wearing your mask, but wear your mask. So I told my brother, I want you to come home. Come home as a Black man, come home, but understand, I want you also to, as you're moving around, understand that this disease is highly contagious, and I don't want to lose you to either. So be conscious of racial bias, and people interpersonally are going to hurl out those things, but be conscious of your health as well. So I think we can do more with messaging to our community in particular around the importance of testing, around the importance of wearing a mask. There's some other things that go with testing, because you just don't test the test. You want to do some contact tracing to say, who have I been around? Like, we are a cultural connected people. And so I've been to my auntie's house, my mother's house, my sister's house, and I haven't had symptoms. I get tested. I have the virus. We want to make sure that everyone's taken care of. And what that means is that we want to give some calls to say, hey, how's your auntie doing? How's your mom doing? We know your cousin's been watching the kids, and we know that you now have the virus. Is your cousin okay? Does your cousin have rental assistance or mortgage assistance? Does your cousin have food? Has your cousin thought about being tested? Is your cousin or auntie displaying any symptoms? And so testing is not in isolation of like, who have you been around? And that's your family, that's your friends. And that includes the case investigation. So all these things are built to help. It's not built to get in your business. We're here to say, we want to know what's happening with your mom, your auntie, your cousin, your friend, and we want to offer support because we are a city that cares about you. So when you think about testing, think about, we care about you and those who are in your circle, because we are a cultural connected people.
The same partnership that came together to do the testing that I mentioned earlier. There's a call that my staff is on probably right now about the tracing piece as well. So looking at it as a whole package. We've got a couple questions in. One of them is, what other steps can families take to become active champions for racial equity in their everyday lives? Normalizing conversations and labeling are good ones to start, like you've mentioned.
I'm just going to say, because with all that's occurring with, and just shout out to just sending prayers to George Floyd, family, friends that are immediately impacted by that, and also the vicarious trauma that we're all experiencing. You may have not knew him personally, but like, it's a lot to take in. It's also in the context of the African-American male who's trying to watch birds. So there's a lot that's happening in this short amount of time. So I would say for our community, it's knowing that that's fatiguing, it's stressful. And sometimes we're told to just go back and operate as normal. And it's okay that you're sad. It's okay that you're angry. Being angry is an appropriate response to systemic oppression and racism. And so the advice would be is just take care of yourself. These types of things can trigger racial battle fatigue and stress, and just take care of yourself. Try to do some self-care things. If you find yourself, I know I actually was doing it last night. I just found myself clicking, watching. And so sometimes it's okay to take a break, because after a while you find your heart rate beating faster, and then you go into a work environment where you're not quite supported as a person of color. So you're mad at work, and then you're mad at the images online, and you're scared for your brother. So self-care, I would say, is the largest thing that we can do for ourselves. Look out for each other. I know the Mental Health Center of Denver is providing some behavioral health things. I know that we gotta get more with that with our community. It's Mental Health Awareness Month as well. Center for African American Health, like, we have a whole center. We have a whole center. So reach out to Deidre and team and take care of yourself and your families, and get involved if you can. If you can't, just take care of you.
And again, we're going to post some different mental health resources in the chat area. Let's do one more quick question, because it's such a good conversation. We've got a question. Are there any resources you would recommend for people of color to start looking into to learn more about racism, white supremacy, and racial equity?
Well, I can say this. Our office, we're ramping up our communication around providing just information around what is racism, right? What is interpersonal racism? What is structural racism or systemic racism, and who can be what? So we're going to ramp up, with the support of our Racial Equity Council, more of that right now. I will also say, I got to shout out Dr. Nita Mosby Henry. She does a lot on this topic. They have their Race University Academies. I know they've had some in the past. She's always a great resource, and just let Nita know I shout her out there. But I would say that those are natural ways. And so I would say, stay tuned, and Deidre, Center for African American Health, will start to promote the things that we're doing to have more outward conversations in our city around when you talk about weaponized whiteness, what does that mean? When you talk about strategic racism, what does that mean? And so these are things that we're actually wrapping up to do that from our mayor's office on social equity, because we are dedicated to race and social justice, as it also intersects with age. It also intersects if you are a person living with a disability. Gotta shout out my colleague, Dr. Russo, in that. So gotta make sure that we're paying attention to how race, and if you are a person with a disability, how that overlaps if you have a chronic medical condition. And so we're gonna keep bolstering those messages coming out here pretty quickly.
Well, Ken, thank you again for joining us today. A heartfelt thank you for everything you've done and continue to do. I'm pleased to be on the Racial Equity Council, and I'm looking forward to what other things we can do to bring resources to community. Thank you all for joining us. Next week, I believe we're going to be in a conversation regarding telemedicine, but we strive each week to really bring resources to folks that are timely and helpful. And as Kim said, take care of yourself and your families. This is a rough time, and it does feel like a gauntlet. Have a good day.